I'm Rochelle Rosen. Welcome to the third symposium and our fourth panel on engaging community voices in digital health design. I want to welcome, I think all of my panelists have turned on their videos. Welcome. I'm going to introduce them and then we'll get started in our conversation. First, I'm going to tell you a little bit about myself. And while I do, we can go ahead and launch poll number 8, please. So welcome, I'm Rachelle Rosen. I'm a medical anthropologist. I'm at the Center for Behavioral and Preventive Medicine at Lifespan's the Miriam Hospital and at the Department of Social Sciences in the Brown School of Public Health. I'm a principally qualitative researcher. So in my research, I use focus groups and interviews in qualitative and mixed methods to design and develop culturally relevant interventions and mobile health products. So being in the role of moderator is my favorite thing to do. So I'm incredibly delighted to be here with all of you. So let me tell you a little bit about the 4 people you're lucky enough to get to hear from today. So with us are Olufunmilola Abraham. Dr. Abraham is an assistant professor at the University of Wisconsin-Madison School of Pharmacy in the Social and Administrative Sciences Division. She's an NIH and Wisconsin Institute for Clinical and Translational Research, or KL2 scholar. She's also a fellow at the University of Wisconsin Collaborative Center for Health Equity and the Morgridge Center for Public Service. Her research goal is to improve medication use for vulnerable and underserved populations, such as children, youth, adults, women, and people who live with serious chronic health conditions. She has over 10 years of experience in conducting research to improve pharmacy practice and the quality of patient care, and her research focuses on the development and dissemination of innovative interventions such as serious games to promote medication safety and adherence. I hope we get to hear more about those serious games. Welcome. Next panelist is José Arturo Bauermeister. He is the Albert M. Greenfield Professor of Human Relations at the University of Pennsylvania. So that's a professorship that recognizes a distinguished professor whose teaching, research, and service focuses on the reduction of tension and the amelioration of relationships among people who differ from each other in race, religion and ethnic identifications, and socioeconomic class. He's also chair of the Department of Family and Community Health at the Penn School of Nursing and director of the Penn Program on Sexuality, Technology, and Addiction Research. He's committed to addressing health inequities among LGBT youth of color, and his research integrates strategies from public health, social sciences, medicine, and human sexuality to create interdisciplinary strategies that do that. Welcome. Dr. Camille Burnett is the Assistant Dean for Equity, Outreach, and Social Justice, and is Associate Professor in the College of Nursing at the University of Kentucky. She's the Strategic Advisor in the Office of Provost for Community Engagement and Academic Partnerships, and the Crowley Day Endowed Professor at the Center for Research on Violence Against Women. She holds many research affiliations, including in the Center for Health Equity Transformation. She is co-lead for the university's Diversity, Equity, and Inclusion Community Advisory Group, and is the Community and Engagement Lead for the University of Kentucky's Unite in True Racial Equality. Unite stands for United in True Racial Equity research priority area. She engages in population health issues to foster health equity and justice by critically examining structural and policy influences that shape health outcomes amongst vulnerable populations. Welcome. And our last panelist is Shawna Butler, who's a nurse, economist, and health tech catalyst. And she's also the builder of the Global Entrepreneurs movement. Shawna aims to better position nurses in our health innovation agendas and as discovery agents, solution designers, and scale agents. Several years ago, she initiated a global conversation highlighting the rarity of nurses in boardrooms, in product design, on innovation teams, in policy development, at tech conferences, and in health media, something we're with you in changing here at CDH, Shawna. She highlights innovative and human-centered solutions that are driven by nurses who are addressing today's most challenging health problems. So I'm really excited to speak to all of you. In my introduction of myself, I talked to you a little bit about my work as a qualitative methodologist. So I'm going to ask each of you to speak in turn, and you can say anything else that you want to about your own research as you also address this question. I'd love to hear what methodologies you use to engage community voices in digital health design. And I'll ask each of you to speak in the order I introduced you. So I'm going to begin with Olufunmilola.
Thank you. Hi, thanks for the wonderful introduction. Hi, everyone. It's exciting to be here. As was mentioned, I lead our Chrome Lab at University of Wisconsin-Madison School of Pharmacy. And in my research, I employ a mixed methods approach. I, similar to Rochelle, started off doing a lot of qualitative work, partnering with pharmacists and youth and parents, and have really seen also the need to combine not just the qualitative piece, but also the quantitative aspect, such that we have measurable outcomes. And that always comes up. So we've seen that mixed methods approach to looking at design of technology, evaluating their impact and feedback from the community is really crucial. The only other thing I'll add is I started off really trying to focus more on pharmacists and how they could do a better job with families and youth. And really, it's the youth that kind of led us in the direction of applying serious games. So that's just one thing I could add, that my lab can't really take credit for that, but it was really humbling ourselves and learning to really listen to our teens coming to the pharmacy that led us in this approach.
Great, thank you. José, do you want to introduce yourself a little bit and talk about the methods you use?
Sure. Thank you, Rochelle, for the wonderful introduction as well. And I completely agree with Dr. Abram. I use mixed methods research, and most of my digital health work is grounded in participatory research. So we build a lot of interventions online for young people, but with young people from the get-go. And so front and center to the participation of young people means not only taking their ideas and profiting in an academic sense of what comes of it, right, towards the public health, but also making sure that they are getting life skills development for their participation, as well as getting paid for their insights and their lived experience. And so as we talk about health equity, I'll say it a million times, but like, pay the people that you work with their fair share.
Yes, we'll definitely come back to that. Next, I think we'll have Camille, please.
Great. Hi, thank you and welcome. Thank you so much for having me, and I really appreciate being a part of this incredible panel. And, as I was thinking about, identifying sort of the methods that I use to do the work that I do, which is not necessarily in this specific space, but it is in the space of health equity and population and public health. I think the first thing that came to mind is relationships. Before I can get into any methodology and start thinking about whether it's qualitative or quantitative, I am a very deeply immersed qualitative researcher, have used mixed methods. But before I even get to that, the biggest foundational piece of the work that I do is building relationships. And it's paramount to be able to do that so that I can engage with the community in a very authentic way, and then use that authenticity to start building the partnerships that we need to be able to do community participatory action research and all those other things. And so I would say that's the core piece that underscores all of that work. And then there's some core beliefs around community engagement research that I think that we can talk a little bit more about as we get through this session, but definitely underscoring the relationships and really just meeting the community where they are, where they identifying, and also identifying the priorities that are important to them and building our research based on that. So thank you very much.
Great. Shawna?
Yes, so one of the titles that you didn't mention is that of being a media maker. So I'm the host of a podcast called See You Now. My methodologies are curiosity, stalking, and interrogation. And I mean that with the greatest amount of love. And a couple people in this call, Megan, will know that that is one of the ways as far as tracking down folks that are doing extraordinary work. So part of this comes from, I think the first place is a deep sense of caring about inequity and unfairness and making sure that everybody has a fair shot. So it starts from a deep place of caring, that method. The second then is curious, like why is this different for other people? Why don't it? So a lot of questions with that curiosity. Then it is going through and sifting through, and where that sifting through is, it's being in a lot of unexpected places. It is being with people. It is being with problems. It is being with pain. It is being with suffering. It is being with joy. it is being with all of those, but making sure that I'm around, and you'll notice that I'm wearing colors to represent diversity and inclusion and pride, but being in places where you're not like the other people, don't look, sound, eat, pray, play like you. So going and being in those places. So when you find people who are doing extraordinary work or solving problems or asking really good questions, that's when the interrogation starts. And that is being an interrogation, a relentless interrogator of really good practices. How did you do this? What was hard? What obstacles did you find? Who was helpful to you? So I think my methodologies at this point, while I am a nurse and an economist, but my role really in all of this is, at this point, I feel like I'm much more of a storyteller and a media maker. And those are the methodologies that I use. And I have found extraordinary people using them. So I highly encourage everybody else to adopt.
Great. When I listened to each of you talk, some of the things I heard were, working with young people or any people from the get-go, right? Making sure you pay them appropriately, pay them as your partner, develop the relationships. And I really appreciated, Shawna, this notion of curiosity and interrogation. I said early on in my career, when I moved sort of from conventional anthropology into behavioral health, I can't believe you're asking people to change their behavior without asking what it feels like, what it means, who helps them do it, what makes it work. And of course, behavioral medicine does in fact do that. But I would love to hear any of you pick up the threads of any of those things. How do we make sure that we are using all of those tools that you mentioned and making sure that there are diverse voices engaged in digital health design from the get-go? You can answer in any order.
Take a first stab at it. I think this is a really fantastic question. For me, one of the things I've learned as a researcher, it starts with humility. That's one of the things I'll add to that list, is really humbling ourselves, even from the get-go, of identifying the kinds of questions that we ask, and even thinking about community partners or members as part of our research team, equal members meant to be paid, people we're learning from, people that we're harnessing their ideas and have to do that in meaningful and respectful ways. Working with youth, I find, in particular, not just paying them, but also thinking about ways to develop them as future researchers that are curious and intelligent and have brilliant ideas. One of the things my lab has found is taking a step back and having a youth advisory board that's nationally representative by age, by ethnicity, by diversity, and really helping us think about even how we're asking the questions, the kind of tools that we're using or instruments, and kind of having them lead and guide and have input at all aspects of the research continuum. So that we found to be very useful, and being humble as we learn from them.
I wanted to pick up on the humility and youth. During this period of time, I get asked a lot, like, what gives me hope? It is definitely our youth. And I use this with a great deal of, as a compliment. They have a recklessness that we need. They are asking a set of questions and to your point, using a set of tools. And I think that there's a genuineness in those questions, because oftentimes it comes from that beginner's mindset. They don't know what a status quo is, but they also have a sensitivity where they're working on an emotional level that helps to know if that's not the right time to ask that question. And they use a completely different language and a different time frame. So I just wanted to applaud the fact that you are thinking about our youngest generation and our newest problem discovery agents.
Yeah, I fully agree with that. I think of them as disruptors as much as I think of them as innovators. When one of our projects, we had gotten funded through the CDC to build a online portal to get young people of color, queer young people of color, to get tested for HIV and STIs. And the premise was, we'll just build us a test locator, and that meets the contract requirement for the CDC. And we took it to our youth board, and they said, Well, have you ever asked us how horrible our experience is when we go get tested at the public health center? It was like, I used to be a test counselor. Yes, I remember. Sometimes I botched sessions and sometimes I had really great counseling sessions. And so instead of just building a test locator, we actually train the young people to be mystery shoppers and to be able to have criterion from a youth perspective of what mattered to them, which we then added to the test locator as a kind of a back-end algorithm. And lo and behold, you can then start matching kids where they are, right? So like if I'm a young kid who, and I use the word kid as a term of endearment, a young person who is still dealing with their sexuality or their gender, then going to a place that the shoppers felt were actually highly competent and humble around sexuality and gender diversity matters more to them. That might be the experience they're looking for in order to get tested. Whereas somebody who doesn't have the socioeconomic well-being to be able to pay for a sliding fee scale to get a full panel of rectal STIs might want to go to a place that has a sliding fee scale or won't require them to pay anything. And so I think it really helps us to think about the tool that we want to build, but also kind of put it back in communities that are going to use them and to contest, I think, the assumptions that we make in public health, right? Like, oh, if I build it, they'll come. Actually not. If you actually ask them and are willing to hear the feedback, boy, will you learn a lot.
I really couldn't agree with all of you more. As everyone's speaking, like, yeah, I get that. Yeah, that's so true. And it really resonates with me. And I think the common thread throughout all of that is really valuing the community as experts, right? And that's what we're really talking about here. And that means that they're included from the beginning and throughout the entire process. And so we are not building something and trying to retrofit it to a community that has had no input. And then we shouldn't be surprised why there's no buy-in, in essence, once it rolls out, right? And so when we value the expertise, we include them as equitable partners in the beginning, and then we prioritize the work that we're doing around what is important to the community versus what's important to us that we try to impose on that group. And so I think that the core piece of all of this, I think in all of our work, is making sure that we value the expertise of the community as experts, and then we're responsive to that, and we include them from the beginning right through to the end.
There's Karen Dale is a nurse who runs AmeriHealth Caritas in Washington, D.C., and she has a phrase that she uses all the time to invite the community to discuss and to decide. Yes. And I love that and to decide part that gets left off. Right. And she's like, you trust your community. You go in and you talk, sure, you've got some data, sure, you've got some ideas. But when you start asking open-ended questions, like what would be the thing that we could change in your community that would make the most difference for you? That opens the discussion as opposed to, do you want A, B, and C? And then as there's discussion, but I love how she says to discuss and to decide. She always emphasizes that part.
You can hear the agency in this small shift, to discuss and to decide, right? It's terribly important. I would love to see the results of the poll that we took at the very beginning. We can see where the folks who are with us think we should focus when we integrate digital health into communities. So I hope that'll come up in a moment. Here we go. So they're with us, I would say. Look, I'm really, we can see that we've talked already a little bit about hospital systems and providers, but there's a strong sense amongst our pollees that we should be focusing on working with community members and community leaders. I'm also glad to see youth organizations amongst the choices. I also really appreciated the notion that we begin with humility. Research has not always been a humble process, and it's not always seen as a humble process. And I think if we can will increase our sense of partnership if we are deciding with the people we are working with, not for the communities in which we do our work. So I think that's terrifically important. I'd love to hear some specific strategies. José gave us an example. I'd love to hear more about how you, what explicit strategies do you use to connect with the communities in which you work, and or to elevate marginalized voices within them?
I could build on what José had shared. In my work, one of the things that I found working with youth is that building long-term relationships. Youth can tell right from the get-go if their research subject, or if they're really a partner and someone you want to spend the time to develop and learn their interests and learn why they're motivated about science or about that research project. And I found that to be really key working with youth is one, inviting them and first learning from them. Why do you want to work with our group or work on this particular project? Learning about their career interests and working with our youth advisory board. One of the things we do is we're meeting with them as frequently as makes sense to them. And even in that time, first having a career development activity that's relevant to their needs and what they want to learn about in science before we're even asking some of our research questions. And we found that this helps us to have that authentic, long-standing relationship with our youth and really invest in them as they're also investing in our research versus just seeing them as research participants. So I found that to be really helpful. Similarly, working with schools where these youth might come from is also thinking about how to give back to the schools, how to contribute to community activities that they have from an administrative standpoint and working with the teacher. So I found it's one, thinking about how can I give back? How can I, just as I'm learning, how can I develop that community as well as learning from that community?
I'll jump into on, oh, Camille, were you gonna say then? Okay, so embedding. And I'm going to use a couple of examples that are not necessarily mine, but I think are really good. So Anita Ravi, she has a clinic, the Purple Clinic, and she works with, when you were talking about marginalized communities, she works with those who have been sexually trafficked, who have endured sexual violence and trauma. And she talks about, it's not so much, she first of all said, everything I learned in medical school, I've had to unlearn. My patients have taught me. And she says that every single day, it's not the people who come in. I mean, they do learn, quite a bit, but she says she worries and learns most from the people who didn't make their appointments. What was missing that wasn't there? What did you need to do? And it's crazy the things that she learns. The bus tokens weren't the right shape. They had the entrance to the door on the wrong side and we couldn't get in. So there are any number of reasons why, but she talks about the people who weren't there and then really embeds herself in their lives. I live in Austin, Texas, and our city manager, when we been dealing like so many cities with high levels of homelessness and his way of figuring out what they needed, he actually went and undercover without, the press or anybody, he just went to live in one of the homeless shelters to go have a better understanding, to embed themselves. And I think Rochelle, you as an anthropologist, who better than Jane Goodall? You actually go and you live there. And I think about the founder of IKEA, what is his name? Ingvar Kamprad or something like that. But he talked about walking around by management and without telling people, he would go in and he would be among the people. And sometimes it would be as though he was shopping, or sometimes it was though he was going to be someone who was a salesperson. But that whole part about being with people and being close to their experiences, I think is just an incredibly powerful tool of insight. And I think the thing that I use most is a choice of language, and not English, Spanish, whatever, the words I choose. Because so many times when we say, oh, this is a digital health, or this is a medical conference, what does that say to anthropologists? Do you feel like you're welcome here? What does that say to traffic designers? What does that say to people who are working with waste and sanitation? So I think that the language that we use, as far as how we position our invitation, is it welcoming? Is it intimidating? Does it make people feel like, of course you have some, of course we're looking for you? So that is the tool that I use, is that I'm really mindful about the language and the invitation and making sure that people feel welcomed, encouraged, and needed.
Thank you so much, Shawna. Again, as she's speaking, there's so many synergies between a lot of the things that all of you said. One of the core tools that I use is the understanding of the history and the context. of the community and the lives of the people who live in them. And it's something that I intentionally do coming into a new institution, into a new area, into a new neighborhood. I have to understand what are the historical nuances that are influencing and shaping and impacting their ability to thrive for human flourishing. And what does that look like? And the institution that I come from, what is the history of that institution? And how is it impeding or impacting or hindering the work that I'm even trying to do in that community? So part of the process for me is really understanding what that history is of the institution that I am showing up representing and of the community that I am going into. And that was really important in some of the work that I have done with particularly our students who often go into different settings for placements, et cetera. And the notion was to create what we called a school without walls, and how we were able to really be with the community. And part of the process was embedding this whole historical aspect of before anybody goes into any spaces, we need to understand the history. And so those students were exposed to in-class discussions and exposures to the history of their institution, to the history of the neighborhoods they were going into, and using that information to recognize, okay, we know that when we're meeting this community, this is the context that surrounds that community. And then we were able to come in again with that humility that Dr. Abram spoke about, and with a new sense of knowing, and then also being cognizant of the languages that Shawna spoke about, of the narrative, and what the narrative and the stories that had been told in those communities and how they were shaping and influencing or interfering with the interactions that we were having. So that's one of the, I think, core concrete tools that I've used. And another one is really just asking the question of the community, what do they need? I mean, the goal of the research that I do is solution-oriented, it's action-oriented. We're not doing research for research's sake. We ideally want to use that research to redress some of the inequities and disparities that all of us have helped to create. And so asking the community, what are those things? What are the areas that you feel that we could be most helpful in service to you? And what does that look like? And then hearing that response and then mobilizing our work around that. And so we were actually able to do that, created an equity institute, and part of founding that as a co-founder of that institute, there was major town hall sessions where people were able to identify what were the core areas of inequity and what ways could the institution start to work and use research to start to redress it. So those are some of the really concrete spaces that I've been able to use and still use to this day.
I could talk to you guys all afternoon. Jose, I was going to turn us just to make sure that we get back to your issue of pay people what they want, but please take us anywhere you want.
No, that's where I'm headed. So I mean, I think it builds on it. When my former life before being in Philly, I was in Ann Arbor, which has a very long-standing history with the people of Detroit and Flint. And part of that challenge has been that the researchers come in, whether it be action-oriented or not, and then they leave and nothing is left behind. And so one of the ways by which paying matters is that even when we bring folks into the lab and say, oh, this is our community partner, or this is the youth advisory board person, that already sometimes can be perceived as a sense of tokenism. Whereas if they're actually an employee, just like anybody else, in the lab of the University of Michigan, I think there is a little bit of justice in the system that they're getting paid there, as I mentioned. But I think more than that, it's a new way by which you can use the power of the university to build resumes, similar to what Dr. Abraham was saying. Like, we do workshops on resume building. This project will end. What is next? But to Shawna's point about language, we fell in love early on with design thinking and human-centered design, because it is something that you can teach anyone. We all, if you have enough inquisitiveness, you can learn the process and you can ask a question and get to the answer that makes the most sense. And so, before we start thinking about the new application that's being designed, we actually refresh, whether we've done it before or not. We refresh ourselves on the 4 stages of design thinking, and then start together de novo every single time. And we end up in very different places. And that's also really gratifying, right? That in terms of power, design thinking, if done correctly, can actually allow people to have kind of the same weight in the discussion. So that's another tip, is like invest in the training of trainers on design thinking and human-centered design.
That compels me to say that one of the poster sessions that's coming up later this afternoon is actually on design thinking, which I think is an important, an increasingly important tool and a language we should share. So in a lot of the world, including the Pacific, where I've done some work, the notion of talking story is really essential to maintaining community relationships and connections. And in fact, in the Pacific, you're not healthy unless you're in good social relationship with the people around you. So inspired by that, I'd love to hear some reflections from all of you about the role of storytelling and communication as a way of engaging community voices specifically for digital health design and the adoption of digital health tools.
I could jump in here. One surprising thing for me working with serious games. So for people who are not familiar with that, those are educational or entertainment games, but have a really major focus on an educational component. So in our group, we tap into serious games to teach about medication safety, opioid safety, cancer prevention. And one of the overwhelming things we've seen with the different games we've designed is really using story narratives. So for example, with our MedSmart game is really one of the things we've learned from parents and youth is build in a story that's real about being prescribed an opioid into the game. And it's really a story narrative that feels like real life and feels like experiences that I might encounter and I have to manage my medication. So one of the things we found is it makes the game real. It makes it easy to take on that perspective of being the player and really learning without feeling like you're in a game or it's too fictional. So I've really been surprised by just the power of using stories from real life experiences and building that into the games we design and how receptive youth and parents have been. So it's pretty powerful is what we found in our work.
Well, as somebody who is spending a whole lot of time doing storytelling, thank you for that. And actually building on that, one of the stories that we told was about nurse Anna Sort, who's also a gamer. And what she's been doing is using games to help teach people better healthy behaviors. So she works with the really big gaming companies, names that you've probably all heard, but she's actually creating characters in the stories who have diabetes. They're using games to talk about sexually transmitted infections. How do you talk to somebody? How do you prevent it? How do you treat it? But it's actually woven into the game so that people can see it. They can see themselves in those stories. And a lot of the thinking that I use about stories is, first of all, when we have data, we've done this beautiful progression of collecting the data, tabulating the data, putting it in spreadsheets. We're getting better at visualizing. We need to have data storytellers. Who are those people who can help us make sense, the sense making? So I have this mantra, no data without stories and no stories without data. But these stories are a really good way, I think, depending upon what topic you're talking about, if it's smoking cessation, if it's human trafficking, if it's a pregnancy that wasn't successful. When we start with that problem or that condition or that situation, and we tell the story of someone, there's a whole lot of people who can see themselves in it. Maybe they're the mother-in-law, maybe they're the school teacher, maybe they're law enforcement, maybe they're the game designer. So the power of story is that it is this magnet that brings everybody into the same crucible and see their role in it and see it from different sides. And story allows you to be a different character. So I think it is so powerful for us to build tools to figure out, and also the interesting thing that we find is that when we have people tell us their stories, we realize things that are really important in the outcome and who the other folks are that are not in our design. And we have not mentioned patients and caregivers. Oh my goodness. Because they're not the patient, they're not the person of record, but boy, do they have a lot to say about, 21-year-old who's not verbal and living in a wheelchair, or a 3-year-old or an older parent. And then we're going to get a better understanding of that clinical condition and that lived life as well, from the caregiver, but also the caregiver needs. And oftentimes those digital tools that we're building, the people who are going to use them most and have the greatest amount of benefit will be our caregivers. So that is my soapbox. Thank you for coming to my TED Talk on caregivers.
Thank you. Our time, I really feel like we started 5 minutes ago, but we are basically at 3 o'clock. So I'm going to just ask you, because we mentioned relationships at the outset, for researchers who want to do community-based work and engage their communities, but might ask us, how do we do that? I'd love to have each of you just offer one piece of advice about how to develop relationships in community. And I'm going to start with José. Thank you for being with us today.
Oh, thanks for having me. I think the easiest way to build relationship is to be honest and straightforward, and understanding that it is an exchange of not just experiences, but also, did I say pay? Have I told you to pay people? Yeah, pay people. And I think that once you iron that out and you feel comfortable renegotiating power and giving power back to the people that you're intending to serve, things have a way of working out.
Anyone else? You can go in the order of your choosing.
I'll go. I think one of the core pieces of relationship building that I've used is meeting people where they are,
right,
and going into the spaces where the community is, and making sure that those relationships are not extractive and that they're sustainable, and using many ways to sustain those relationships, but knowing that you are in it for the long haul. And that's where you start to build trust with that community. So those are a few of the nuggets that I would leave with everyone today.
Thank you. And thank you for being with us.
Thank you.
I will pick up on a point Dr. Burnett mentioned earlier. I am a big advocate of mentorship and education, is find people who are engaging with communities in a really respectful and meaningful way, learn from them, read, be prepared, don't go into the community blind, and again, be humble and be prepared to learn from others.
Thank you.
Yeah.
Shawna, you get our last word.
I'm going to go with José, because I'm going to start buying all my, in addition to stocking, now I'm going to buy them. I'm going to pay for them. So that's one thing. But as far as building relationships, one of the things that I use all the time is, I think it's really good to be a champion and to be an accomplice. And, by champion, I mean, you give people political cover, whatever it is in your institution, you share your platforms, you amplify, elevate, and escalate their voices. And I think that that's, by doing that, you can be not only the ally, but I think more importantly, being the accomplice. I've got skin in the game here, and I'm going to take every bit of risk with you. And I use that from the standpoint of building trust, learning, coming at it with humility. And I had not used pay along with my stalking. So I might get in trouble with, any bribery laws here. So José, I'm calling you at 3 a.m, and you are going to bail me out, buddy.
I said fair pay, no bribery.
Fair pay.
It started here, and I hope it continues. So thank you to all 4 of you. It's just been a delight to hear your voices today.